Welcome to CAE Podcast with your host, Ilan Gagnon, Vice President, Public Affairs and Global Communications at CAE. This special edition podcast brings together CAE Defense and Security, Healthcare, and Civil Aviation training solutions to talk about COVID-19 and new perspectives on training. Check us out at cae.com/defense-security/ or subscribe on your podcasting platform of choice.
Okay, well, hello everyone, and welcome to CAE Radio Podcast. I have the tremendous pleasure of having three of CAE's most forward visionaries here with me today. So first, we have Amar Patel, who's the Chief Learning Officer at CAE Healthcare. Welcome, Amar. We have Chris Ranganathan, Chief Learning Officer at CAE Civil Aviation Training Solutions. Welcome, Chris. And finally, we have Joe Armstrong, who's Vice President of Global Business Operations, Products, and Solutions at CAE Defense and Security. Welcome, Joe. Thanks for joining us today. So during today's podcast, we'll discuss how COVID-19 has had an impact on training for CAE's customers and the industry. So we'll look at how CAE has innovated to support its customers during the pandemic and what the new reality of training will be like going forward. So why don't we just jump right into it? And first, maybe I'm going to ask you, Joe, to tell us how has the pandemic impacted training for CAE's customers in the defense and security world?
Sure. Well, Helen, our number one focus is certainly the safety of our employees and our customers across all of our facilities worldwide. And one of the unique things I think about our defense business is, unlike many other areas and sectors of the economy, defense and security has been declared as an essential service from governments the world over. And so the partnership that we have as a company with our customers, in every nation in which we work, has allowed us to continue to think about creative ways of delivering our training services to those customers to ensure that they are always mission ready and capable of performing the duties that they're asked to do on a daily basis. Over 90% of our operational sites are actually operational today, and continuing to deliver that service and those support to defense forces. So it's been a very interesting journey for us as we've gone through the requirement to maintain and sustain operations, and yet making sure that we're actually doing that in the sense of protecting our people, protecting our employees, and certainly protecting, our customers and the men and women who operate military services around the world. In some cases, we've actually taken the opportunity to take the great training capacity that we have and morph that into emergency management training. And in fact, I can point to areas of the world like Brunei, where we operate a multi-purpose training center on behalf of the Bruneian government, where we've actually taken emergency management courseware and started to deliver that not only to Bruneians, but other nations around the world. And so I think that's a testament to our agility as a company to take the concepts that, really reside deep within us in terms of providing a training service, to be able to adapt to this new reality, continue to deliver that service, and then think about ways that we can even enhance, the traditional types of skills that we provide, and then provide that to support our customers worldwide.
Thanks, Joe. And maybe, Chris, if I turn to you for civil aviation, how has the pandemic impacted training for CAE's customer in your world?
Well, Ellen, I think as expected with the downturn in world traffic, airlines have been conservative about their training requirements, and we've seen a reduction in training demand across all business segments in commercial aviation and business aviation, and to some extent in the flight training. So apart from their conservatism, in many cases, customers that would have liked to travel to training centers have been restricted by travel bans and then availability of hotels in some cases to position their people to our training centers. So there's been a general drop-off in training. We've seen that bottom out. We're beginning to pick that up again now. Of our 50 training centers worldwide, those that have stayed open, primary focus has been on employee and trainee safety, like Joe mentioned, and we've employed protocols to manage that going forward. For the cadet or ab initio training programs, where there's been an interruption to flight training because the centers closed or the students have stayed away due to local health requirements, we've anticipated a loss in proficiency as they've spent time away from the cockpit. We've had to evaluate how long that's been and then adapt the curriculum to ensure they pick up where they left off.
Okay, thanks. And Amar, on your side, we're facing a major public health
Yeah.
pandemic, public health issue. So, how has this pandemic affected the training of the professionals in the medical world?
I think it's completely flipped it upside down a little bit, right? So much of healthcare has been reliant on in-person education and training and competency assessments and tools, and all of a sudden now we're living a world of where everything is forced to be digital, right? And certainly for us, the health and well-being of our employees is priority as we work closely with healthcare professionals in their institutions, and so certainly that's changed the landscape of how we provide education and training. On top of that, a lot of the elements that we considered healthcare norms in terms of training have completely changed, right? The world of in-person training, doing clinicals inside of a hospital, the ability to be able to access certain tools like personal protective equipment, face masks, shields, gloves, all doesn't exist anymore in a pandemic, right? It's very much tied to making sure that our patients are taken care of and are safer. And so it's certainly forced us into look at more unique offerings of digital. And the unique thing, for us at CAE has been we've been in this pathway for digital for some time. So it was just adapting to the new times and really helping our customers see the value of content and education in the digital world, and certainly help them change the culture around them. So for healthcare, it's certainly been a massive change across the board, and certainly looking at how just-in-time training is now pivotal more than ever to ensure competency.
Absolutely. And maybe if I come back to you, Chris, on the civil side, we know that a lot of the aircraft are grounded in many commercial airlines in the world. But what types of training have been most needed during the pandemic, and how has the training delivery changed or been modified?
In terms of the types of training required, it's been more or less a general reduction overall. There's not been one specific type of training that's required more than another. Where the training has dropped off in the commercial aviation, it's taken a while to come back, whereas in business aviation, we've seen a bounce back far quicker, especially in North America, as travel restrictions have been reduced. But what has changed is when training has come back, the way we deliver training is significantly altered. And like Amar said, we were on the path to digital in any event, and we weren't alone. I mean, the corporate learning and development departments have been delivering training remotely for years at large scale. The aviation, specifically the civil aviation market, has been somewhat conservative because we were so heavily regulated about the use of technology and distance learning for credit training. But that's changed. And with COVID, we worked with regulators to deliver much of our ground training in using virtual live, quite as much as we're doing today. This is both in pilot training and technician training for maintenance as well. We also have been able to deliver a lot of primary flight training grounds using remote training facilities. And this has required significant cooperation. It's required significant education externally to authorities and to customers that this was actually possible. But it's also required us to change some of the courseware we've developed, because we could not simply take courseware that we developed for an in-person training experience and adapt it to remote learning. And plus, it's required some retraining of our instructors to use the technology and as well as to manage perhaps more than one learner having difficulty accessing the training. So that's been a bit of a learning curve for us, and we've gotten better as we've done that. And what we've been proactive in doing, and we reached out to authorities and industry bodies and do this, is actually develop guidance material for the industry to implement remote live training. We worked, for example, in commercial aviation with an industry body, IATA, to develop a white paper on the use of virtual classrooms and how that could be implemented, what the drawbacks and the pitfalls were, as well as provide our input to a white paper on return to work for airlines as they began to spin up post-COVID.
That's going to be very useful. And on the defense and security side, Joe, perhaps you could share what types of training were most in demand during this pandemic, and how has the delivery changed during that time?
Sure, and I'll harken back to my last and previous comment saying, for defense, given that 90% of our operations have actually continued throughout the pandemic, what that's actually meant for us is that the nature of service, as we always deliver, has actually stayed very much the same. Where we've seen a fairly substantial shift that creates an opportunity for us and our customers is to try and start taking advantage of the ability to, provide things like distance learning, distance education, access to instructors that are not necessarily physically co-located with students. We have examples right here at home in Canada for the NATO Flying Training in Canada program that we operate in Moose Jaw and in Cold Lake, where the Canadian government, absolutely realized that they need to continue to provide, a training service to their students. And we provided, again, remote instruction through the classroom so that students could still have access to all the training curriculum and training material that we would normally provide, and yet be able to access instructors who were not able to travel from their own house, right? And I think what's fascinating to me is just think about what we're doing right now, right? We all have unique backgrounds. We all have, and I mean background, like the things that are actually presented to be, behind me and behind each of us. It doesn't matter where in the world we are in, right? We can provide a dialogue. We can provide assistance to our customers. We can provide instruction almost seamlessly, like you and I are sitting across from the table, right? Yet all four of us are sitting in different places. We're probably all sitting in our houses. So I think that fundamentally transforms the way people think about receiving information and certainly receiving training. We have had an opportunity in defense to deliver what we called off-board instructor operator stations, because of course, one of the issues that we have when we're providing physical instructors, co-located inside a simulator, with our students or with students of our customers, of course, is the need to try and reduce the close contact that you would normally have by sitting inside a simulator. So being able to simply have, an instructor station that sits outside the simulator that provides all of the access and visibility to everything that's actually going on in an aircraft representation in a simulator, again, allows us to provide services to our customer that are remote, but still very close and co-located. It still allows us complete access to everything that's actually going on the part of the student who's going through training. And again, I think we see more and more opportunities to provide, that type of either co-located but physically separated training services that are just as good as if you're literally sitting inside the cockpit with a student right beside you. And so, our customers are interesting in the sense that, they have to operate regardless, right? Military fleets around the world were not grounded. They still had to perform their mission, which means their personnel still have to sit side by side, right? A pilot and a co-pilot and a navigator are sitting in a small cockpit. So having to have conversations with our customers to say, look, there's still opportunities for us to try and create, increased opportunities for physical distancing, yet still receive the same training service, has again been an education education activity on the part of us, educating our customers on the opportunities that are available to them, try and do more enhanced methods to protect their students and protect our instructors. I think the take home is that we're now in a world where everybody is open to change, right? And I think we're so well suited and positioned to be able to affect that change across our industry, whether or not it's civil healthcare or defense, that we just have a great opportunity to take advantage of what has been a very difficult situation for many people.
Yeah, absolutely. And Amar, for the professionals in the medical field, any types of training that was more in demand, I guess, related to the pandemic itself?
I think to Joe's point earlier, right, the healthcare workforce didn't change. It still had to be boots on the ground, and if anything, we had to double and triple our workforce in a super short period of time, right? We saw individuals that came out of retirement that had to be put into place. We saw field hospitals being mounted all over the world where they could handle additional resources and people, and you saw just-in-time training happening in fields, right? Especially like in London, where they opened up a field hospital and had to train 4,000 people overnight, right? So certainly those elements are key to the work. Things that really started to bubble to the surface as a result of the pandemic was airway and ventilator training, right? And certainly you saw individuals in demand because of just the notion of the disease and the impact it had on the respiratory system. And so we saw everything from PPE, right, to gloves, gown, mask, goggles. And, one of the biggest reasons for transmission of COVID-19, like so many other pathogens of high consequence, was because we didn't properly know how to clean our hands or wear gloves or wear a face mask or cover our face when we cough. And right. So much of the training that certainly came to be was because of those simple things that created so many complex situations. On the healthcare side, we pushed out adaptive learning, education, and training, and something unique, even in the discussions of learning, are we have the e-learning as a rote self-directed education element, but what about training that is custom to meet the needs of the individual, right? So learner-centered education that adjusts and tweaks to be not only 10 minutes or an hour, but certainly based on your individual knowledge and base experience, and pushing that out to be able to be done in ventilator education or PPE or other things that we were doing certainly was a high demand item in this environment right now.
And maybe I'm going to continue with you, Amar. I want to know if you could share what you think will be training and education trends coming to the forefront, given the current climate.
Who would have thought that a pandemic would push the digital initiatives globally, right? Who would have thought that it's going to be the digital accelerator that we needed to do that? I do think adaptive learning and remote education is going to be here to stay, especially on the healthcare side of the house. We're seeing a lot of case study-based environment education happening where this, like a Teams environment where physiology modeling, ventilatory education is happening in a virtual instructor-led environment or in a simulation self-directed environment. Right, we're seeing certainly profiles of individual learners becoming the future of what we need. Data is a key cornerstone to our work, right? More now than ever, with people being such distant away, for me to be able to understand where your base knowledge is and teach you and give you competency to the point where I'm comfortable letting you go without ever stepping foot into something is certainly pivotal. And the elements of digital learning, digital simulation, data adaptive is our future, is absolutely what's going to drive us forward.
Chris, on your side, any insight on what you believe will be the training and education trend coming to the forefront?
Yep, some of it is identical to what Amar and Joe said. It's accelerated the move to digital and the use of data, certainly, and then that's something that will stay with us. I don't think it's going to go away, mainly because the customers get used to it. And in a highly regulated industry, the regulators are now comfortable. They're forced to become comfortable with the ability to deliver training remotely. Whereas previously it would have possibly taken us 5 years to get to where we are today. It's happened in about 5 months. In general, in the civil aviation training, across all segments, I see our customers asking us for training that is more efficient and effective. Cost is a key driver in the industry, and they want to see even more than ever the training dollar translate into improvement in line operations. So that's going to be key for us going forward. Off-board or remote instructor operating simulators is technology we're working on now. It requires recertification in several cases from authorities around the world. While primarily today we see this as a means to keep our instructors distanced from students, it's naturally going to translate into efficiencies where we can have instructors deliver simulated instruction across locations, right? And for us, this is a great thing because you have consistency. You're able to have super instructors mentor other instructors remotely. This is something we've always struggled to do. And for the regulator, it allows them to evaluate the effectiveness of our training remotely as well. So it makes that, I don't think that will go away. I believe that will accelerate. Other trends that were already moving in one direction before COVID will continue to go that way. For example, in the civil aviation training market, especially post the 737 MAX accidents and the relook that industry has had on the aircraft certification, I'd expect to see increased participation of training providers such as us in determining the initial and new training requirements for aircraft types. Traditionally, this has been an area where the training provider is a passive recipient of training requirements and did not have much choice. But I see that increasingly change as we become owners and providers of training data, and training data becomes increasingly used to determine training requirements. In the business aviation segment, something we've been working on for years, and again is going to come to the fore as airlines seek and operators seek efficiency gains, is the use of what's called standardized curricula in the FAA world. This is where we begin to get one set of curricula for a platform type or variant, and one set of approvals to use it, as opposed to having to individually go back to the regulator and seek approval for every training center that seeks approval for the same platform delivered in their facility. I see that as being significant. And finally, before the COVID crisis, in the pilot training, civil pilot training market in particular, instructor shortage was a significant byproduct of the pilot shortage. Airlines snapped up instructors; their pilots stayed on till later, and training providers around the world struggled getting high quality instructors and keeping them. With the layoffs or furloughs from the airline, we now have a pool of extremely qualified pilots and pilot instructors from the recent experience in the airline world that become available to us. We see the use in training directly, and also the use of subject matter experts in developing courseware.
That's going to be very useful. Yep. So, Joe, finally, on your side, can you share your insights on what are the training and education trends that you see?
Sure. Well, it's interesting just following from both Amar and Chris, and I'll touch on the impact that the downturn on the commercial side has had in terms of restoring, let's say, a pool of instructors back into the population. And one of the big challenges that we had in the military, and this was common across all governments and all militaries world over, was the attrition rate that military pilots were experiencing in the military and air forces were experiencing, as those pilots were looking towards having a quote unquote better life in the commercial aviation sector, business aviation sector, and of course leaving in droves from military pilot training and military operations. Now, obviously, with defense being, again, an essential service, maintaining operation and so on, it provides us an ability to potentially restore, the instructor pilot base that we actually have servicing the military. Now, whether or not that's working for industries such as ourselves and providing that service directly back to the military, or, returning as reservists back into the military itself, has a dramatic change, obviously, in the makeup of military pilot training. What's interesting is you look at the U.S. Air Force as an example. They're very much focused on making a recognition that is actually, in fact, happening. But instead of having to worry about repositioning and replacing and moving people all over the world or to training bases around the U.S., the idea of having a centralized capability, not centralized by geography, but virtually centralized to actually access a pool of talent that can then be delivered again as a training service or instructor service to anybody anywhere in the world or anybody in the continental U.S. So it suddenly creates a level of flexibility that we've never seen before in our industry. And I think one of the areas that I find fascinating is tying to what Amar commented about in terms of performance data and training data, right? It's no longer about measuring just the performance of a training system, right? It's about understanding the mechanism that we deliver training and the impact that training delivery actually has on human performance. In other words, the students that are actually going through a training system, and how do we tailor the delivery of our training media and our training services to actually match the characteristics of people. And if you think about even in our own operation and how we conduct meetings, how we conduct requirements reviews with a customer, how we actually mentor our own employees, the whole concept of now having to do all of this remotely is exactly the same kinds of things that we're addressing on the training side, in the sense of we don't want to just be providing as a remote instruction without all of the, let's call it, collateral benefits of having a relationship with our students or a relationship with our employees. So all of this now is centered around how do we better understand how people actually work and operate, how people learn, how people, and in a remote condition can actually be supported perhaps better than we were able to do by actually having everybody physically co-located in one place or in one location.
Well, that's very insightful. And I think all these trends, as you're mentioning, are here to stay. The three of you shared some insights about things that have changed and are probably going to remain that way and will accelerate the change. So thanks for sharing. So in terms of our final question, because time is flying, I want you to share perhaps what you think in terms of emerging technologies. What excites you about the future? I'm going to start with you, Joe. So any new technology that excites you in the defense world?
Lots excites me, Helena. I'm
I
always
know that's why.
so that's never hard for me. There's a couple of things that I get really excited about. One is, and we've been talking about, the strategic direction of our organization in general, right? And saying, there's a interesting balance that we're playing now. There's a balance of technology, right? And looking at technology and what can technology do to us. There's a balance of people. And, I just spoke about the importance of really understanding the human condition in the environments that we operate. And if I really think about how do you pull all this stuff together into something that becomes a unified strategy as well as a unified vision for the future, it's what is our job? I mean, if you think about it, our job is really, taking reality, right, and converting that into something that's digitized, something that's driven by technology, and taking and being able to deliver reality in the hands of anybody, anywhere in the world right now, right? And if you think about what we do with simulation, what we do with virtual environments, representing the world, I mean, that's our job, right? Our job is representing the world in a synthetic way or in a different way, and then making it consumable by the people that actually have to operate it. Whether or not they're students going through a training system, whether or not they're decision makers that are, making critical decisions based on taking data from all sorts of locations and all sorts of sources and then making it interpretable by them, right? That is our job fundamentally at the end of the day. And if you look at where technology has advanced, everything through networking technology, digitization, big data analytics, artificial intelligence, our ability to do ultra high fidelity representations of the world around us, every one of these things is, again, all about representing reality in a better way that makes us as people more effective in all of our jobs. And so I find that unbelievably exciting, right? Because to me, what it means is we have no limit anymore, right? We have a situation now that's been spawned by this, unfortunate series of events. I think there was even a movie with that title that's created an infinite opportunity for us as technology providers and service providers who really put our focus on understanding people, right? Understanding how people work and operate and what it is that we have to do to actually make their life, their world, their day a better place, an easier place, and to make them more effective. So that's like a whole vision that I get really passionate and exciting about. There's a lot of things that fall out of that, right? Cybersecurity is a good one. I mean, the whole concept of saying, well, we're taking reality and making it easier to consume and easier to interpret and understand means, well, we have to protect that, right? Just as we are concerned about our own physical security or location security, building security, defense and security, it doesn't matter, right? We have to be protecting assets and we have to be protecting the data that people rely on. And so I certainly see a real increase in the need for us to understand the cybersecurity domain and make sure that actually, parallels the developments and evolution of technology that we bring out to the customer space as we go forward in the future.
Absolutely. And Chris, I'm going to ask you to perhaps be short and share maybe one emerging technology that excites you about the future.
Yeah, no, that's easy to do because I think you're going to hear very common themes from all of us on technology. But I'd like to preface what I'm about to say by saying that fundamentally, I believe our approach needs to be people-centric. We need to apply robust training design to look at the problem we're trying to solve and not just throw technology at it. If I had to talk about something that no one else has talked about thus far, I'd like to talk about the use of informal learning. This is when people look up information in the course of doing work. Think about it. A pilot goes to work and he has to look up a manual because it's been some time since he's applied a particular procedure. He looks it up, consumes that, and performs that task successfully. Yet he comes back into recurrent training, let's say 6 months later, and guess what's on his curriculum? The very same task he's just performed. The reason we do that is we don't know what he knows or don't know what he doesn't know. But technology is available today. Imagine your Google search. What you're doing and what's presented to you is based on your learning history, really, or your browse history. The exact same technology can be applied to adult learning. Because what you're doing is expressing a training need, coming back to what do people actually want to know, being able to harness that, use that insight to drive new training content, and space learning content is what excites me most.
Very interesting. And Amar, I'm going to finish with you, but I don't want us to end this podcast without you saying a few words about the CAE R1 ventilator that we're seeing in your background, something that CAE has pioneered and invented first in 11 days and then submitted for certification in Health Canada in only 6 weeks. So I want you to talk about an emerging technology generally in your field, but talk about that particular technology because everyone at CAE is so proud of what we're doing in that area.
Yeah, certainly. I think from an emerging technology standpoint, I think the way we provide communication is emerging, right? We've heard about data and analytics and augmented and virtual reality and the leveraging of different types of technology for just changing how we do immersive learning. But certainly, I think what we're forgetting is the way we do conferences and educations today has changed. Right, no more in-persons. It's all virtual and digital. I think the whole world around us is certainly emerging and learning how to do these large person scale programs that are highly immersive and interactive. And that's certainly an emerging element. For us on our side, we're super excited about R1. Certainly, as you already mentioned, it was something that we undertook as a large scale project and pushed it forward. And all of us at CAE are absolutely excited to let it out, right? To let it go and to let it really impact patient care and really make an impact on the world around us. And so R1 was built out of the love of making healthcare safer and really changing how CAE contributes to healthcare and healthcare patient safety. It supports complex ventilations and it's designed for hospital systems. It's we're certainly on that forefront of new technology. Here it is right here. It's very pretty, it's very functional, it's very effective, and it's well designed for these complex COVID patients. And I think we're at a point all of us are just ready to let it out the door and let it really make that impact.
Absolutely. Well, thank you so much. And thank you for joining us today. I hope you enjoyed this first podcast by CAE. And thanks to our panelists, Joe Armstrong from CAE Defense and Security, Chris Ranganathan from CAE Civil Aviation Training Solutions, and Amar Patel from CAE Healthcare. I think we've heard that CAE's mission is all about safety. We were impacted by the pandemic, but definitely we have adapted. We've changed our practices and we have so much insights on how the training will evolve going forward. But we're ready to take that on and to make the world a safer place as well. So thank you all for your participation today. Take care.
Thank you.
Thanks, Joanne.
Thank you for listening to CAE Podcast on COVID-19 and new perspectives on training. If you want more information about CAE, please visit cae.com.